Hello and welcome. This guide is designed for you. Being a medical director in a skilled nursing facility is challenging, yet rewarding. You are a leader, a mentor, and a guardian of quality. Your influence touches every resident and staff member. The landscape of long-term care is constantly evolving. In this dynamic environment, your role has become more crucial than ever. Think of yourself as a co-captain of the clinical ship with the rest of the leadership team. This is a tremendous responsibility and an incredible opportunity to make a lasting, positive impact. Your success will be built on a foundation of collaboration, communication, and a shared commitment to excellence. This guide is here to support you on that journey. Let's discuss CMS compliance. Think of CMS regulations as a compass, guiding us toward providing the highest quality of care for our residents. CMS sets the standards for skilled nursing facilities, outlined in the State Operations Manual, the rule book for our industry. Aligning with these regulations builds a culture of safety and excellence. We'll simplify this complex world, focusing on the why behind the rules, empowering you to confidently lead your team toward exceptional resident care. This guide is designed to be practical and directly applicable to your daily work. We'll explore real-world scenarios and cases to transform abstract rules into actionable knowledge. We will focus on the State Operations Manual, relevant F-tags, care planning, infection control, and QAPI. Understanding CMS metrics is essential for your facility's reputation and 5-star quality rating. Finally, we will focus on leadership, collaboration, and team building. Our goal is to leave you feeling confident in your ability to lead your facility to new heights. Let's demystify CMS. The Centers for Medicare and Medicaid Services is the federal agency that administers the nation's major healthcare programs. CMS is the primary architect of the healthcare system for millions of Americans. CMS sets the rules, standards of care, and manages payment systems. Understanding its role is fundamental to your success. The primary mission of CMS is to ensure beneficiaries have access to high-quality healthcare. Their work directly impacts your daily operations. As a medical director, your relationship with CMS is constant. CMS collects and publishes data on facility performance through the Care Compare website. Your goals and the goals of CMS are, at their core, aligned. The State Operations Manual, or SOM, is the official guide that CMS provides to state survey agencies. For a medical director, the SOM is an indispensable resource, translating federal regulations into actionable guidance. Appendix PP breaks down each regulation, providing definitions and investigative protocols, including specific F-tags. The SOM can seem dense, but familiarity with its structure helps you find information relevant to your clinical leadership role. Use the SOM for guidance and problem solving. Think of the SOM as a tool for proactive problem solving and quality improvement. The survey process is how CMS enforces regulations, usually through unannounced visits every 9 to 15 months. Surveyors start with an entrance conference, meeting the leadership team, including you, the medical director. This is your chance to set a professional, cooperative tone. They observe care, interview staff and residents, and review clinical records, focusing on a sample of residents. As medical director, you may be interviewed about clinical policies or your role in QAPI. Be prepared, honest, and concise. More importantly, your systems and clinical culture are on display through your team's actions and documentation. The survey ends with an exit conference, where surveyors present their findings. Listen, take notes, and ask clarifying questions. This is not a debate, just a chance to understand any deficiencies cited. Your response to these findings shapes your facility's improvement plan. A prepared, engaged medical director can turn the survey into an opportunity for growth. Lead with confidence, and the survey becomes a tool for better care, not just a regulatory hurdle. The State Operations Manual, SOM, is most valuable between surveys, not just during them. Effective medical directors use the SOM proactively, integrating its guidelines into daily routines and QAPI meetings. Structure QAP discussions around regulatory areas. Use SOM guidance to audit programs like fall prevention or pressure ulcer care. For example, if pressure ulcers increase, use Appendix PP to create an audit tool and address system gaps before surveyors do. This approach shifts focus from passing the survey to delivering excellent care. Make the SOM a teaching tool, review protocols with staff, answer questions using the manual, and foster a culture of compliance. Encourage your team to see the SOM as a resource, not a threat. Embed it in education and quality improvement efforts. Empower staff with knowledge to provide compliant, person-centered care. Proactive leadership with the SM builds a truly outstanding facility. FTAG 656, Comprehensive Care Plans, is the roadmap for every resident's care. These plans must be person-centered, developed by an interdisciplinary team, and include the resident and family. Your leadership ensures care plans are meaningful, not just paperwork. For example, Mrs. Garcia, a retired dance instructor, fears losing her ability to dance. Her care plan should reflect this personal goal, not just standard rehab steps. As medical director, ensure the team is consistently reviewing plans to ensure medical interventions support unique resident goals. Avoid generic, outdated care plans. Update them as conditions change. Regularly review and question. Are we addressing the residents' current needs? Are changes documented? Dynamic, individualized care plans keep your facility compliant and residents thriving. Your oversight transforms care planning from a task into a tool for real quality. Make every plan a living document. That's the heart of FTAG 656. FTAG 880 Infection Prevention and Control demands a robust, effective program, not just policies on paper. As medical director, you ensure the program protects residents and staff, working closely with the infection preventionist. The regulation covers hand hygiene, PPE, enhanced barrier precautions, cleaning, and outbreak response. If you spot lapses, like staff not changing gloves, address them immediately and use them as teaching moments. During outbreaks, activate the predetermined response plan. Cohort residents, test, communicate, and manage medications. Your leadership in these moments demonstrates compliance and commitment to safety. Systems matter. Prevention is everyone's job, but your oversight is key. Surveyors look for real-world effectiveness, not just written protocols. Lead by example, and infection control becomes a strength, not a vulnerability. FTAG 880 is your shield. Use it well. Pressure ulcers are painful, preventable, and a major survey focus. FTAG 686 sets the standard. Prevent ulcers with thorough risk assessments, individualized care plans, and interventions like turning schedules and nutrition support. As medical director, ensure plans are comprehensive and orders are in place. Sometimes ulcers are unavoidable due to severe illness. Document all interventions and clinical reasons clearly. Without strong documentation, surveyors may cite deficiencies. When ulcers occur, collaborate with the wound care team, review assessments, treatment plans, and address underlying issues. Ask, are we missing infections? Is nutrition adequate? Is pain managed? Your active involvement shows commitment to quality and compliance. FTAG 686 is about prevention, treatment, and dignity. Make your oversight count. Every ulcer prevented is a win for residents and your facility. Medication management, especially antipsychotics, is high risk and under scrutiny, covered by FTAG 755. Ensure medications are necessary, properly prescribed, and monitored. Antipsychotics require clear diagnoses as outlined in the quality metrics, documented rationale to include risk and benefit, and key diagnosis. Agitation and anxiety are not considered appropriate diagnosis. Attempts at gradual dose reduction should be coordinated with the staff and your pharmacy consultant. Champion non-drug interventions first. Investigate causes of behaviors before prescribing. For example, if a resident is agitated, rule out pain, medical issues, or other psychosocial stressors, and try non-pharmacological approaches. If medication is needed, document thoroughly and monitor closely. Ensure that there are monthly reviews of psychotropic use and support dose reduction efforts. Your oversight protects residents and meets regulatory expectations. FTAG 755 is about safety, necessity, and vigilance. Be the gatekeeper for responsible medication use. A close cousin to infection control is FTAG 881, which mandates that every facility have a formal antibiotic stewardship program. This program is a coordinated effort to improve antibiotic use by ensuring that residents who need these powerful drugs get the right antibiotic at the right dose for the right duration. The goal is twofold: to enhance treatment outcomes for individual residents and to reduce the broader public health threat of antibiotic resistance. As the primary clinical leader, your role as medical director is to champion, guide, and provide oversight for this program, making you the chief steward in your facility. The regulation requires your stewardship program to include core elements for antibiotic use, such as protocols for optimal prescribing and systems to monitor antibiotic use. This is not something the nursing department can or should do alone. it really requires deep physician involvement. You can lead the development of these protocols. For example, you can help make sure evidence-based criteria are used consistently, such as Loeb's or Magear's criteria for initiating antibiotics for a suspected urinary tract infection, guiding prescribers to avoid treating asymptomatic bacteriuria. This helps ensure that antibiotics are reserved for residents who will truly benefit, avoiding unnecessary side effects and the development of resistant organisms. Let's walk through a case. A nurse calls an attending physician about Mr. Smith, who has a cough and a low-grade fever. The physician, busy in their office, orders a broad-spectrum antibiotic over the phone. An effective stewardship program, which you oversee, would prompt a timeout. The nurse, empowered by your protocols, might ask, "Doctor, our stewardship protocol suggests we obtain a sputum culture or chest X-ray and consider a viral panel first. Would you like us to proceed with that before starting the antibiotic?" This simple intervention, supported by your leadership, promotes diagnostic accuracy and prevents the knee-jerk prescribing of antibiotics for what might be a common cold or influenza. Your role also involves reviewing data. Your antibiotic stewardship program should track metrics such as the number of antibiotic starts per 1,000 resident days and the percentage of residents on antibiotics at any given time. During your QAPI meetings, you should be reviewing this data with the team. If you see a spike in antibiotic use, you can lead the investigation. Are we seeing an increase in one particular unit? Is one prescriber an outlier? By analyzing this information, you can identify opportunities for education and process improvement, strengthening your program and demonstrating to surveyors that you are actively managing antibiotic use in a responsible and effective manner. Our final key area is FTAG 689, which focuses on accidents. The regulation requires that the facility environment remains as free of accident hazards as possible, and that each resident receives adequate supervision and assistive devices to prevent accidents. While this covers a wide range of potential hazards, the most common and scrutinized area is resident falls. Falls are a leading cause of injury, hospitalization, and death among nursing home residents. As medical director, your leadership is essential in creating and sustaining a comprehensive, interdisciplinary fall prevention program that goes beyond simple interventions and addresses the unique risks of each resident. Compliance with F689 begins with a thorough risk assessment for every resident. This assessment should be multifactorial, looking at issues like gait and balance problems, medication side effects, vision impairment, cognitive status, and environmental hazards. Based on this assessment, an individualized care plan must be developed. For a resident at high risk, this might include physical therapy, medication review to eliminate drugs that cause dizziness, ensuring proper footwear, a good toileting plan, and making sure items like the call light and water are within easy reach. Your job is to promote this holistic approach, moving the team beyond just putting up a high fall risk sign. Let's consider Mr. Chen, who has fallen twice in the past month. A reactive approach is not enough. Your leadership should drive a thorough root cause analysis after each fall. The interdisciplinary team should meet to discuss what happened. Was the fall unwitnessed? What time of day did it occur? Was he trying to get to the bathroom? Was he recently started on a new blood pressure medication? By asking these detailed questions, the team can identify specific contributing factors and modify the care plan accordingly. Perhaps Mr. Chen needs a scheduled toileting program or a review of his medications by the pharmacist. This systematic post-fall huddle is a hallmark of a strong program. As medical director, you also play a critical role in managing falls that result in major injury, which is a key quality measure. When a resident suffers a significant injury like a hip fracture, you must be involved in the immediate response and subsequent investigation. You help ensure the resident receives appropriate medical evaluation and that the facility thoroughly analyzes the event to prevent recurrence. Your oversight of the entire fall management system, from proactive prevention and individualized care planning to robust post-fall analysis, is fundamental to creating a safer environment, improving resident outcomes, and ensuring compliance with the critical requirements of F689. Your facility's performance is judged by quality measures, or QMs. Think of these as your facility's clinical report card. They are publicly reported, allowing consumers to see how you stack up. They are a major component of the CMS 5-star quality rating system, impacting your facility's reputation. Understanding these metrics is essential for effective leadership. They are derived from clinical data your staff collects, primarily through the Minimum Data Set, or MDS. Quality measures are categorized into short stay and long stay. You need to be able to look at your facility's QM report, identify areas of weakness, and translate that data into actionable clinical initiatives. Short-stay quality measures provide a near real-time pulse on your facility's performance, especially concerning post-acute care. A heavily scrutinized QM is the rate of rehospitalization. Another critical QM is falls with major injury and new or worsened pressure ulcers. Mr. Jackson is admitted after hospitalization. Your leadership ensures a robust process is in place. Review these metrics with your team regularly. When you see a negative trend, you must lead the deep dive. Transform these metrics into a powerful tool for enhancing care. Long-term quality measures paint a broader picture of care for permanent residents. Key metrics include antipsychotic medication use, physical function, and mobility. For example, a decline in mobility could negatively affect your mobility QM. As medical director, investigate and adjust care plans to promote each resident's highest function. Instill a culture that values long-term outcomes. Celebrate successes and share data with your team. Connect data to person-centered care to empower staff and improve long-term quality. As a medical director, your role is like a conductor, leading the interdisciplinary team, nursing, therapists, social workers, dietitians, and CNAs. Your leadership brings them together, ensuring they play in harmony for each resident. Be present in the facility, engage with the team, and attend key meetings. Champion the interdisciplinary process, framing resident issues as team challenges. Your leadership inspires the team, setting the clinical tone. Celebrate successes, acknowledge hard work, and focus on quality to inspire excellence. Building partnerships happens in the daily interactions between departments. As medical director, you act as a bridge, fostering relationships between nursing, administration, and therapy. A facility where departments work as true partners is more efficient and delivers safer care. Your partnership with the administrator and the director of nursing is the cornerstone of facility leadership. Building a strong bridge to the therapy department is vital to maximize resident function. Finally, do not overlook the importance of your relationship with frontline staff, particularly the certified nursing assistants. They are the eyes and ears of the facility. Take the time to learn their names, ask for their input, and listen to their concerns. A compliant and high-quality facility is a learning organization, and as the lead clinician, you are also one of its most important teachers. Your role extends beyond directing care to empowering staff at all levels with the knowledge and confidence they need to excel. Education is not a one-time event, but an ongoing process, and your involvement can have a powerful ripple effect, elevating the clinical competency of the entire team. When you take the time to explain the why behind a clinical protocol, you transform a task into a meaningful action, fostering a deeper understanding that leads to better decision-making and more compassionate care. One of the most effective teaching strategies is the teachable moment. These impromptu learning opportunities arise constantly in the daily life of a nursing facility. For example, while reviewing the chart of a resident with a new pressure ulcer, you can invite the unit nurse to look at it with you. Instead of just giving an order, you can discuss the likely contributing factors, the rationale for a specific dressing choice, and the key prevention strategies for the future. This brief, case-based lesson is often more memorable and impactful than a formal hour-long lecture, as it connects knowledge directly to the real-world experience of the staff. You can also play a more formal role in the facility's education plan. Offer to lead a quarterly in-service on a topic of high importance, such as antibiotic stewardship or the proper management of dementia-related behaviors. Your participation lends significant weight and credibility to the training. When the medical director personally takes the time to teach about non-pharmacological interventions for agitation, it sends a much stronger message than if the same material were presented in a standard training video. You can share real-life case studies from your own practice, making the content more relatable, engaging, and persuasive for the entire team. Ultimately, the goal of education is empowerment. When staff members understand the clinical reasoning behind their work, they become more confident and proactive problem solvers. A CNA who understands the link between hydration and UTI prevention is more likely to actively encourage a resident to drink fluids. A nurse who understands the risks of antipsychotics is more likely to suggest environmental changes before calling for a new medication order. By investing your time in teaching, you are not just sharing information. You are building a smarter, more capable, and more empowered workforce that is better equipped to provide safe and person-centered care. In any high-stakes environment where passionate people work closely together, disagreements are inevitable. As a leader, you will undoubtedly face situations that require you to have difficult conversations. This could involve addressing a performance issue with an attending physician, questioning a family's unrealistic care demands, or mediating a conflict between two departments. While these conversations can be uncomfortable, your ability to navigate them constructively is a hallmark of effective leadership. The goal is not to win an argument, but to guide the situation from conflict toward a collaborative solution that prioritizes the residents' best interest and well-being. Preparation is the key to successfully managing a difficult conversation. Before you initiate the discussion, take the time to gather all the objective facts. If you are addressing an attending physician about their high rate of antibiotic prescribing, for example, have the specific data from your stewardship program ready. Plan your opening statement carefully. Approach the conversation with a tone of inquiry and shared purpose, not accusation. You might start by saying, "Dr. Jones, I was hoping to get your thoughts on some of our recent antibiotic usage data. I value your perspective as we work together to ensure our stewardship program is as effective as possible." During the conversation, practice active listening. Allow the other person to express their viewpoint without interruption. Try to understand their perspective, even if you do not agree with it. Acknowledge their points to show you are hearing them. "So, what I hear you saying is that you're concerned about missing a serious infection." This de-escalates tension and builds a foundation of mutual respect. Then, calmly and clearly present the facts and rationale from your perspective, always tying the issue back to a shared goal, such as resident safety, regulatory compliance, or quality of care. Focus on the problem, not the person. The final step is to work toward a mutually agreeable solution. Frame it as a collaborative effort. In the case of the physician, you might ask, "How can we work together to meet our stewardship goals while ensuring you feel confident that your patients are being treated safely?" This might lead to an agreement to implement a new diagnostic protocol or to have the DON provide more detailed information when calling for an order. By transforming a potential confrontation into a problem-solving session, you not only resolve the immediate issue, but also strengthen the professional relationship, building a more resilient and collaborative team for the future. Let's focus on building a sustainable culture of quality. At the heart of this is the Quality Assurance and Performance Improvement, or QAPI program. As medical director, you are QAPI's most important champion, providing clinical vision. You are a key member of the QAPI steering committee. You help the team analyze data and prioritize areas for improvement. You bring a crucial clinical perspective. For example, with UTIs, you can lead the discussion beyond catheter care. Champion QAPI by fostering a culture of psychological safety. Your leadership transforms QAPI into a shared, proactive mission to make care safer and better for every resident every day. Even the best organizations will occasionally have a bad outcome or receive a deficiency. The true measure is how a facility responds. Guide your team in transforming negative events into catalysts for lasting improvement. When a deficiency occurs, develop a plan of correction. Ensure it's a robust strategy that addresses the root cause. Drive implementation and monitor effectiveness. Ask in QAPI meetings how actions are progressing. Inspire your team to view challenges as opportunities for better, safer care. Embrace data as tools for growth. Excellence is a continuous pursuit. We have covered a great deal on this journey. As we conclude, remember the importance of your role. Being a medical director is more than a job, it is a calling. Your leadership touches every resident. The path is challenging, but your impact is great. You create a symphony of high-quality care. Embrace this role with confidence and humility. Remember the trust placed in you. You are the guardian of your residents' well-being. Thank you for your commitment.